Have you ever experienced a time of utter sadness, like you're isolated from everyone else in the world as your future turns bleak? You continue to marinate in the sadness until suddenly it stops and everything seems right again. Odds are you have. Whether forming from the death of a loved one or a low grade on a math test, we all get a feeling of shame and disappointment towards oneself that is hard to overcome. But what if a feeling constantly recurs and is prolonged for a great amount of time? This is an everyday thing for those who suffer from a tragic disorder known as depression. Depression is defined as a persistent feeling of sadness or a lack of interest in any outside stimuli. During depressive states, brain activity slows down, the frontal lobe shrinks by about 7%, and the hippocampus is vulnerable to stress-related damage. Depression arose from the interaction of an adverse environment plus a genetic susceptibility, but not from either alone. Here in this video, I'll be spreading awareness for two kinds of this cruel disorder. These two kinds are major depression and dysthymia. Although they are both very similar, major depression and dysthymia have a couple key differences. Major depression is a severe form of depression that usually lasts for at least 2 weeks, while dysthymia is a less severe depression, but can last over 2 years. Dysthymia is also chronic, while major depression happens in spurts. No matter what form of depression you have, the causes, symptoms, and treatments are all the same. Depression is the leading cause of disability worldwide, plaguing 5.8% of males and 9.5% of females. In the US, more than 20 to 26% of women and 8 to 12% of men suffer from depression at some point in their lifetime. As shown in this statistic, women are much more prone to any form of depression compared to men, by about a 2-to-1 ratio. The reason for this mainly stems from depression's tendency to co-occur with other illnesses and mental conditions. It can result in correlation with anything from pregnancy to more chronic or recurring problems. According to the National Institute of Mental Health, 25% of cancer patients, 1/3 of HIV patients, and 1/3 of heart attack survivors all suffer from depression. Another reason to why women are susceptible to depression is due to the fluctuating hormones and genetic predisposition, particularly around the times of puberty, childbirth, and menopause. The largest determining factor for depression is found in your family tree. This means that if your first-degree relatives, such as parents and their siblings, have depression, then you are more likely to have it too, compared to the general population. Depression is not only genetic, it can also be caused by overeating, undereating, or changing your sleep patterns. Emotionally scarring events have a great impact on depression as well. A loved one's death, a ruptured marriage, an alcohol or drug addiction, and a lost job can all cause depression. Once you obtain depression, there are numerous symptoms that you endure. A lot of these symptoms affect your daily life, such as an increase in sleeping, a lack of sleeping, overeating, undereating, restlessness, lethargy, and the withdrawal of your regularly scheduled activities. Your mood also changes as you begin to be more irritable, lash out at your loved ones more often, become easily agitated, and continuously have a negative outlook on life. You can even go to the extremes and commit suicide while in a depressed state. Celebrities including Lady Gaga, Billy Joel, Ellen DeGeneres, Jim Carrey, and Halle Berry have all struggled from this disease. In addition, actor Robin Williams passed away from a suicide linked to a severe depression. People like Williams feel like the depressed feeling is too overbearing for them to handle and decide to escape it by ending their own lives. If you yourself are having thoughts about suicide because of depression, please call the NDMDA hotline as printed below. Fortunately, this disorder can easily be treated. There are several types of therapy that can be used on a person with depression. These include cognitive behavioral therapy, and psychotherapy. Doctors can prescribe some antidepressant medications such as bupropion, venlafaxine, and mirtazapine, depending on a person's individual needs. People can also use electroconvulsive treatment, or ETC, which transmits small electric currents into the brain. However, this medicine is not recommended by medical psychiatrists, as it's only used for extreme cases. Approximately 80% of patients who seek treatment for major depression show improvement within 4 to 6 weeks, so it's very important to seek treatment as soon as you can recognize that you have this disorder. Depression, I bring great news. Depression has been becoming easier and easier to treat as technology advances. However, the fight is not over. People are still being tortured from this disease worldwide. It's time for you to make a difference. The Anxiety and Depression Association of America, or the ADAA, has been the leader in the research, training, and education involving depression for many years. It would be an amazing help for you to donate to this great organization using the link below, and help us put a limit on depression to a minimum globally. It is your turn to make a difference. Think about the people spending their daily lives in hatred of themselves and their lives. Do you really want them to continue this struggle? It's your choice.